Hello. Hello, am I audible? Okay, hello. Okay, hello everyone. Welcome to today's demo lecture. I am Ali Sayed and I will be discussing in brief about the autonomic nervous system today. So let's dive straight into the topic. My topic is Introduction to the Autonomic Nervous System. So what is the autonomic nervous system? Whenever we hear the word autonomic, it means autonomous, something which is involuntary. It happens on its own. We can imagine our body as a high-tech self-driving car. Like the ANS is its main pilot, it is the autopilot. It is working behind the scenes to keep everything running smoothly without you even having to think about it. So the autonomic nervous system, obviously it is a complex network of nerves. It's like a complex network of nerves. It will control involuntary bodily functions. Now what are involuntary bodily functions? We all know, like heart rate, breathing, digestion and temperature. It is also responsible for obviously maintaining homeostasis. Mainly the autonomic nervous system is responsible for rest and digest and fight or flight responses. And it is also crucial for adapting to changing environments. So these are some of the divisions of the ANS. Obviously we are going to focus on the first two, which are the parasympathetic and the sympathetic system. The parasympathetic system, it is the rest and digest system. Whenever we are sitting on our couch, eating something, sleeping, using our phones, this is the system which will be active, rest and digest. And here acetylcholine will be the principal neurotransmitter. Whereas the sympathetic system, whenever we are in danger, any kind of danger or any stressful environment, flight or fight response, this is the system which will be activated. And here adrenaline or noradrenaline, both of these, they will be the main neurotransmitters here. Third, the enteric nervous system. Now the enteric nervous system is not necessary to learn, like from a GPAT or NIPER point of view, and it is interconnected with the sympathetic and parasympathetic systems. The enteric system will be controlled by both of these systems, and it also has some of functions of its own. A division of the ANS. How do we divide it? It is anatomical in origin. How do we divide it? Fibers of the sympathetic system. See here, sympathetic system. Here they originate from the thoracic and the lumbar spinal cord, and therefore they are called the thoracolumbular outflow. It's called the thoracolumbular outflow. The sympathetic system, its autonomic nerve fibers originate from the thoracic and the lumbar spinal cord. Therefore, it is called thoracolumbular outflow. Whereas the parasympathetic nervous system, here it will originate some from the cranial nerves, which are 3, 7, 9 and 10. It is important to remember these nerves from where it originates, and sacral nerves, the spinal cord. Therefore, it is called craniosacral outflow. Now, all autonomic fibers will form a synapse in the ganglion. Now, what does it mean? A synapse, we all know, it is like a gap between two neurons. For example, this is a nerve fiber, this is another nerve fiber. It contains some receptors here. This nerve fiber, see there is a gap present here. there is a gap here. It is called the synapse. Here a neurotransmitter will be released which will act on these receptors here present on the another neuron or nerve fiber, and then it will relay further actions. This is a synapse. Now what is a ganglion? A ganglion is like a relay station. Many nerve fibers are present in a ganglion. It will process and organize all of these messages which come from different parts of our body, like many nerve fibers innervating a particular area. Many nerve fibers coming in a particular area. Here they are organized, they are rearranged, processed, and then all of these nerve fibers, their messages from the neurotransmitter will be sent ahead. So ganglion is like a collection of synapses, you can say. It's like a connection of all the synapses. So here all the autonomic fibers will form a synapse, they will form a gap in the ganglion before they will supply the organ. See here, the eye. Before supplying the organ, they will form a synapse here in the ganglion, and thus they can be divided into pre and post ganglionic fibers. Now in the sympathetic system, the post ganglionic fibers here. What are the post ganglionic fibers? The fibers which originate after the ganglion, like where the message, once the message reaches the ganglion, it will be processed and then it will be sent to the corresponding organ with the help of a post ganglionic fiber. So in the sympathetic system, always very important to remember this, in the sympathetic system, the post ganglionic fiber, see here, which is originating after the ganglion, this fiber will always be either long or it will be equal to the preganglionic fiber. In the sympathetic system, the post ganglionic, post means after the ganglion, whichever fiber originates after the ganglion will be either longer to or it will be equal to the preganglionic fiber. Whereas in the parasympathetic system, see here, the parasympathetic system, this one, here the preganglionic fiber will be much longer, which means that the ganglion is present closer to the organ. For example, here is, you can say this is bronchus here, bronchus smooth muscle. So in the parasympathetic system, the preganglionic fiber will be longer than the postganglionic. Very important to remember this. Moving further ahead, now I'll explain in brief about a parasympathetic nervous system. Now a parasympathetic nervous system, here we know responsible for rest and digest. Rest and digest functions mostly performed by the parasympathetic nervous system. Here acetylcholine, it is the principal neurotransmitter which is secreted by preganglionic as well as postganglionic fibers. It is very important to remember that in both the systems, in the parasympathetic as well as the sympathetic system, the preganglionic nerve fiber, the preganglionic, which is before the ganglion, it will always release acetylcholine. Always. The preganglionic neurotransmitter will always be acetylcholine. Whichever system you take, either parasympathetic or sympathetic. Let me go back here. Like see here, even in the sympathetic system and the parasympathetic system, wait, let me clear this. Even in the sympathetic system, the neurotransmitter before the ganglion is always acetylcholine. हमेशा acetylcholine ही रहेगा प्री गैंग्लियोनिक फाइबर से रिलीज होने वाला. गैंग्लियन के पहले acetylcholine ही रहेगा. And afterwards, like in the parasympathetic system, obviously acetylcholine only will be released, acetylcholine ही रिलीज होगा पोस्ट गैंग्लियनिक फाइबर से भी, लेकिन सिंपैथेटिक सिस्टम में पोस्ट गैंग्लियनिक फाइबर नॉर एड्रेनलिन रिलीज करेगा या एड्रेनलिन रिलीज करेगा. So very important to remember this. The preganglionic fiber or the preganglionic neurotransmitter, you can say, will always be acetylcholine, and then the postganglionic fiber can release either acetylcholine or it will release noradrenaline or adrenaline depending upon the division of the nervous system there. So coming back to our parasympathetic nervous system. Since acetylcholine is the principal neurotransmitter here, it is known as a cholinergic system. Since acetylcholine is the principal neurotransmitter, it is also known as the cholinergic nervous system. Now, how is it synthesized? Acetylcholine is synthesized from acetyl coenzyme A and choline. Now, how is it synthesized? First, acetyl coenzyme A, it is taken up into the neurons. Choline will be taken up within the cholinergic neurons. This uptake of choline, first of all, choline is taken up by our cholinergic neurons. This uptake is the rate limiting step in the biosynthesis of acetylcholine, which means that this step will determine the rate at which acetylcholine is synthesized in our body. Now, this step is inhibited by hemicolinium. Remember, hemicolinium inhibits uptake. It will inhibit the uptake of choline, which is the first step in acetylcholine synthesis. And after it is uptaken by the neurons, acetyl coenzyme A and choline will combine to form acetylcholine. Now, once this acetylcholine is formed, it will be stored in the vesicles. Now, this step of storage in the vesicles, it is inhibited by Vesamicol. Now, how do you remember this? Like Vesamicol. So, by the name Vesamicol, you can remember vesicles, like Ves. So, vesicles. Once acetylcholine is formed, Vesamicol will inhibit its storage into the synaptic vesicles. Now, once it is stored, it has to be released to act on the postsynaptic receptors. So, this release, it is released by exocytosis whenever a nerve impulse will stimulate the neuron. So, this step, the release step will be inhibited by botulinum toxin. Botulinum toxin will inhibit the release step. Moving ahead. Now, these are the types of cholinergic receptors present in our body. Mainly two types are present. Muscarinic receptors and nicotinic receptors. Now, muscarinic receptors, these are G protein coupled receptors, which means the receptor will be coupled to a G protein and then further cascade reactions will take place. You just remember this for the moment. Muscarinic receptors, these are G protein coupled receptors, and nicotinic receptors will be ionotropic. Ionotropic means ion linked, either ligand gated or voltage gated. We will cover this in the general pharmacology class when we start full-fledged classes. So don't worry, we will explain this to you, all the type of receptors. For now, just remember the types of receptors. Muscarinic receptors, these are G protein coupled, and nicotinic receptors are ionotropic. Just remember this. Now for the location of these receptors, this part is very important. First we'll do muscarinic. Muscarinic receptors, there are 5 main types: M1, M2, M3, M4 and M5. Now mainly for GPAT or any exam, we do not need to remember M4 or M5. Not necessary to remember them. You only need to focus on the first 3 types: M1, M2 and M3. So the location of M1. Now how to remember this? Now there are many tricks on how to remember location of these receptors and their actions. Mainly remember this: M1 and M3. M1 and M3 both stimulate whichever organ they are present in. They will stimulate it, increase its activity. उसकी एक्टिविटी बढ़ाएंगे वो M1 and M3, जो भी ऑर्गन में वो प्रेजेंट है, जो भी ग्लैंड्स में प्रेजेंट है. लेकिन M2 will inhibit, it will repress, एक्टिविटी कम करेगा वो. Now how to remember this location? M1 mainly present in the gastric ganglia and CNS, but its major action which we have to remember is in the gastric ganglia, in the stomach. And M2 present in the heart, mainly present in the heart. M3 present in all of the rest of the organs. I'll explain how to remember this. M1, there is a mnemonic which I'm sure you all must have heard. It goes like पहले खाओ, eat first, फिर दिल लगाओ. पहले खाओ, फिर दिल लगाओ. बाकी काम बाद में, which means rest of the work afterwards. First eat. Now how to remember this? पहले खाओ means M1, first. पहले खाओ M1, present in our stomach. फिर दिल लगाओ M2, present in the heart. बाकी काम बाद में M3, all of the work afterwards. So how to remember this? Imagine you are just arriving at an event, any event. You are very late. आपको बहुत भूख लगी है. You are very hungry now. But there is food only for one person left. You are very hungry. You've just worked a lot, and now food is left only for one person. You arrive there. There is a very beautiful girl standing behind you in the same line. She also wants that food. So how you'll remember this? पहले खाओ. I'll eat first. I won't let her eat. I'll eat first. पहले मैं खाऊंगा. फिर दिल लगाओ. Let the girl come afterwards. First you eat, then the rest of the work. M1, M2 and बाकी काम बाद में. Always remember. Now for M3, how do you remember M3? How will you remember M3 now? For M3, now we learnt the cholinergic system, rest and digest. You know rest and digest systems. You're resting now. You're watching your phone. You're watching your phone on the couch. आप लेटे हो आराम से. I. What will it do? We remember M3. What it does? It stimulates this receptor. It is whichever organ it is present in. जो भी organ में ये रहेगा, it will stimulate it. So in the eye, what does it do? It will stimulate it. It stimulates the constrictor muscle of the eye, and it causes miosis. Remember here, I'll explain the actions in the further slides. M3 present in the eye. It is also present in the GIT. Obviously, here also it will stimulate the GIT. Present in the bladder. All of the rest and digest functions you remember. If you remember rest and digest, आपको location याद आ जाएगा. M1 and M2, you remember their location. All the rest glands, organs or smooth muscles, M3 will be present. In the bronchus, smooth muscle, M3 will be present. And in the glands, now which glands? All of the exocrine glands. Exocrine secretions जितने भी हैं, like sweat. M3 stimulates, therefore will increase sweat, will increase lacrimation, tears, आंसू बढ़ाएगा. Lacrimation it will increase, and it will increase salivation. So all of these actions will be increased by the action of M3. Now one more way to remember M3 is like M3. So it can be mouth, mucus and muscle. Mouth, to remember salivation, you can remember the exocrine glands. Mucus, bronchi and muscle, all of the smooth muscles, GIT, bladder, etc. Now, here I have made a table of some of the selective agonists and antagonists of all of the subtypes. Now, I don't have any trick for this, you'll have to learn it by heart. क्योंकि हर चीज़ का mnemonic रहेगा तो you'll get confused. This you'll have to remember by heart. Like M1, subtype is M1, a selective agonist, oxytremorin. All of the actions of M1 which we just saw, like increasing its action in the gastric ganglia, its action in the CNS, they will be enhanced or agonized by oxytremorin. Now selective antagonists of M1, pyrenzepine and telenzepine. Both of these drugs will inhibit the action of M1 receptors. And therefore, they are used in peptic ulcer. because as we know M1 will stimulate, M1 receptor will stimulate whichever organ it is present in. So it will stimulate HCl secretion in our stomach, and therefore these antagonists can be used in peptic ulcer diseases. Now moving further, M2 receptor. Now by M2 you can remember M2 like two M's. So selective agonist can be methacholine, first M, and antagonist will be methoctramine. There is no other way to learn this, you will have to learn it by heart. M3 receptor, selective agonist will be bethane-coal and antagonist will be dariphenacine. Now dariphenacine is mostly used in overactive bladder. Whenever there is increased micturition, increased urination, dariphenacine will be used. And for M4 and M5 there are no selective agonists or antagonists. Now these were the muscarinic receptors. Moving further to the nicotinic receptors. First one, NM subtype, neuromuscular. It acts on the neuromuscular junction. Neuromuscular junction, what it does it is present in the skeletal muscles. Stimulation of the NM receptor will cause contraction of the skeletal muscles. What are the selective agonists of the NM receptor? Remember, the nicotinic receptors were ionotropic. So stimulation of these receptors will result in a change in the action potential of whichever cell they are in. Action potential change होगा ये receptors के through. So NM receptor, selective agonist, nicotine and phenyl trimethyl ammonium. An antagonist, tubocurarine. Tubocurarine will cause neuromuscular blockade. Remember this. Well, the NN receptor. The NM receptor, it is present at the autonomic ganglia. Like we just learned about the preganglionic and postganglionic fibers. For example, this is a nerve fiber. This is another neuron. Here there are receptors present. These receptors are NN receptors. These are the NN type of receptors. Neurotransmitter will be released here, acts on NN receptors. Selective agonists, nicotine again, and DMPP, dimethyl phenyl piperazinium, is a selective agonist. An antagonist, hexamethonium and trimethophan. They are used in emergency hypertensive states. Like they are not conventional drugs. They are not used in everyday therapy. Okay. Moving further, functions of the cholinergic system. Very easy to remember this now, since we know all the locations of the receptors. Muscarinic actions. Any organ you pick, we know GIT. We just learned action of the M1 receptor. Pehle khao, eat first. M1 will act here. What does it do in the GIT? Now we learned M1 and M3 both stimulate. M1, M3 both will stimulate. So M1 in the gastric ganglia will increase HCl secretion. HCl secretion mainly by M1 and M3, and thus it will increase the risk of peptic ulcer disease. Remember the selective antagonists we gave, pyrenzepine and telenzepine. Both will be used for peptic ulcer disease. Now peristalsis of the GIT will also be increased because of M3 action. We learnt M1, M3 both stimulate, so peristalsis will be increased and sphincters will be relaxed. Now in the heart, M1, M3 will stimulate any organ they are present in, but M2 is an inhibitory receptor. It will inhibit, repress the action. So in the heart, the parasympathetic system will have an inhibitory effect, and therefore it will lead to negative chronotropic. Chrono means rhythm. So rhythm means it will decrease our heart rate. Rest and digest. Remember the cholinergic. Rest decreases our heart rate. And negative dromotropic, decreased conduction. It will decrease our heart rate and decrease the conduction as well. M2 receptor in the heart. It is very important to remember the locations of the receptors. Just remember the locations and just remember what they do. M1, M3 will stimulate and M2 will inhibit. There is no need to learn the functions by heart. If you just understand their location, if you just remember those locations and what those receptors do, you can easily guess or you can easily predict what will be the actions. Now all of these actions are orchestrated by acetylcholine, obviously, by acting on these receptors. In the blood vessels, no direct cholinergic supply is present. There is no direct cholinergic supply. No nerve supply is present in the blood vessels. तो मोस्टली कोई कोलिनर्जिक सप्लाई रहेगा नहीं ब्लड वेसल्स में, लेकिन M3 रिसेप्टर है. M3 रिसेप्टर प्रेजेंट है एंडोथीलियम पे, ब्लड वेसल्स में. तो कोई भी एक्सोजीनस ड्रग यानी कि कोई भी ड्रग हम दिए विच कैन स्टिमुलेट दिस रिसेप्टर्स, तो उससे वेसोडाइलेशन होगा. इट विल कॉज रिलीज ऑफ नाइट्रिक ऑक्साइड. रिमेंबर दिस एक्शन ऑन द ब्लड वेसल्स. डायरेक्ट कोलिनर्जिक सप्लाई प्रेजेंट नहीं है ब्लड वेसल्स में, बट M3 रिसेप्टर्स प्रेजेंट है ब्लड वेसल्स पे. वो रिसेप्टर्स को स्टिमुलेट करेंगे, इट विल रिलीज नाइट्रिक ऑक्साइड रिजल्टिंग इन वेसोडाइलेशन. Now in the eye, we remember which receptor is present? M3. M3 what it will do? Stimulate करेगा. What it will stimulate? The sphincter pupillae muscle, which is the circular muscle of the eye. And वो stimulation होने की वजह से it will result in meiosis, constriction of the pupil. We can call it pinpoint pupil. Pupil का diameter decrease हो जाएगा. M3 present in the eye will stimulate the sphincter muscle of the eye, circular muscle of the eye. Sphincter constrict हुआ, this will result in meiosis. Pupil का diameter कम हो जाएगा. Now this action is very important in glaucoma. This causes constriction of the ciliary muscle and accommodation is possible. This action is actually desirable in glaucoma. And the glands, all of these are stimulated by M3. M3 से stimulate हो गए. Cholinergic system, as we learnt, M3 receptor stimulates the secretion, increased salivation, lacrimation and sweating. Now in the urinary bladder, it will stimulate the detrusor. Always remember, urinary bladder का action increase हो रहा है. So increase हो रहा है मतलब क्या? Increased urination. So to increase urination, we will have to relax the sphincter. Do not get confused. The sphincter is relaxed of the urinary bladder. Sphincter relax होगा. This will lead to increased micturition. Nothing but urination. Now in the bronchus, again M3 stimulates the bronchus. The smooth muscle of the bronchi stimulate होगा मतलब it will get constricted. So it causes bronchoconstriction. And therefore, by using anticholinergic drugs, mostly in asthma we use this ipratropium. There is a drug. This drug antagonizes this function. It opposes M3 action in the bronchus and causes bronchodilation. Bronchodilation, this is useful in asthma. Now moving ahead for the nicotinic actions. Autonomic ganglia, the ANN receptors are present in the autonomic ganglia. And as I explained, both the sympathetic and the parasympathetic ganglia, दोनों sympathetic और parasympathetic, दोनों nervous system के जो ganglia है, they will be stimulated by acetylcholine through ANN receptors. Acetylcholine दोनों systems में present रहेगा as a pre-ganglionic neurotransmitter. This is very important to remember. Pre-ganglionic neurotransmitter will always be acetylcholine, always, in these systems. and then the NM receptors. Acetylcholine will stimulate the skeletal muscle. This will cause contraction through NM receptors. So what can be some of the side effects? Like if there is increased parasympathetic activity, अगर हम parasympathetic activity को बढ़ा दें, तो what can be the possible like additional effects or side effects? There will obviously be an extension of the actions of the cholinergic receptors. जितने भी हमने actions learn करें, अगर वो excess में हो जाए तो क्या होगा? Like bradycardia. अगर M2 का action ज़्यादा हो गया, it will lead to decreased heart rate. Decreased heart rate की वजह से it will cause bradycardia. And too much M1 and M3 stimulation, it will cause spasm in the GIT. Excess M3 activation will cause increased urination. Increased M1 action will cause peptic ulcer, and then increased M3 action again will lead to an excess release from the exocrine glands. There is one more side effect, bronchoconstriction in asthma. This is also because of M3. Okay, so this is the conclusion of the parasympathetic nervous system. We saw the introduction, then the types of the cholinergic receptors, muscarinic and nicotinic, and how to remember them. Then we saw some selective agonists and antagonists of these receptors. And then their functions. So moving ahead, the sympathetic nervous system. What is the sympathetic nervous system? We can imagine it like our rapid response team. ये अपनी एक रैपिड रिस्पॉन्स टीम है बॉडी की. जैसे अपने NSG के कमांडोज होते हैं, हाईली स्पेशलाइज्ड. Rapid response team like the NSG commandos, they are ready to tackle any threat. Sympathetic nervous system will always be activated either in a flight or fight response. Now what is an example of a flight or fight response? Imagine you are surrounded by thieves who have weapons with them. आप रात के टाइम अकेले हो, बहुत सारे चोर, they have surrounded you. So what will be your body's response to this? Obviously, it will lead to activation of our sympathetic nervous system. What will it do? Our heart rate will increase, obviously. Heart rate increases. Our heart rate will increase. Contractile force will increase of the skeletal muscles or of any muscle. The contractile force will increase. Because this is literally a life or death situation. Blood and oxygen will increase. This is increased blood and oxygen, so that increased oxygen is pumped to our muscles because they have to act. Our airways will be relaxed. Why? So that more oxygen can get in. Our pupil will dilate. Why? Why will it dilate? So that more light can get in. And if increased light gets in, we can see our sense of vision will be increased. हम ज़्यादा देख पाएंगे. So we can analyze the threats in our immediate environment. Therefore, our pupil will dilate. Airways will be relaxed so that more air can get in, more oxygen can get in, and more oxygen and blood will be supplied to the muscles. Our heart rate will be increased. Our blood pressure will be increased. Blood pressure is also increased. All of this to orchestrate the flight or fight response. So moving ahead, in the sympathetic nervous system, noradrenaline, it is the principal neurotransmitter. Principal means it is not the main, like it is not the only neurotransmitter, but at most of the sites we will find noradrenaline. And therefore, the sympathetic nervous system is also called as adrenergic system because of noradrenaline. And apart from noradrenaline, adrenaline and dopamine are also part of the system. And together they are called catecholamines. Now this is just the synthesis of these neurotransmitters. But it is important to remember the steps and the drugs which inhibit those steps. Like synthesis में, first it will start with tyrosine. Firstly, circulating tyrosine in our body, it is transported to the neurons. Noradrenergic neuron हो सकते हैं, adrenergic neuron. It is transported to the basically sympathetic neurons. Here after transport, tyrosine will be converted to DOPA, dihydroxyphenylalanine. Dihydroxyphenylalanine. So circulating tyrosine is transported to the neurons, where by the action of the enzyme, see here, look in the diagram. By the action of the enzyme tyrosine hydroxylase, tyrosine is converted into DOPA, which is dihydroxyphenylalanine. Now this step is the rate limiting step, which means this enzyme will decide the rate at which noradrenaline is formed. and this enzyme is inhibited by tyrosine. This is the drug which inhibits tyrosine hydroxylase. Now once DOPA is formed by the action of enzyme DOPA decarboxylase, it will be converted to dopamine. This is DA. DOPA is converted to dopamine. This step is inhibited by carbidopa. Now carbidopa is a very important combination drug. It is used in Parkinson's. It is used along with levodopa. Levodopa plus carbidopa combination is used. For now, just remember, carbidopa will inhibit enzyme DOPA decarboxylase. So in the synthesis, first there is tyrosine. Tyrosine will be converted to dihydroxyphenylalanine, which is then converted to dopamine. Now this dopamine, it will be transported to the storage vesicles. Now this transport is inhibited by reserpine. Reserpine, tetrabenazine and valbenazine. All of these drugs will inhibit this transport of dopamine into the vesicles. Why is it being transported? Because there it has to be converted to noradrenaline. Dopamine in the storage vesicles is converted to noradrenaline. This is done by the enzyme dopamine beta hydroxylase. Dopamine to noradrenaline conversion will be done with the help of enzyme dopamine beta hydroxylase. And then further conversion of noradrenaline to adrenaline will not take place inside the neurons. Now why does this happen? ये conversion क्यों नहीं होगा neurons में? This will happen in the adrenal medulla but not in the neurons. This is because the sympathetic neurons lack a key enzyme. उनके पास एक एंजाइम नहीं है जिससे नॉर एड्रेनलिन में कन्वर्ट होगा. दैट एंजाइम इज फिनाइल adrenaline. That enzyme is phenyl ethanolamine and methyl transferase. This is the enzyme that is responsible for the conversion of noradrenaline to adrenaline, and this conversion will not happen in the neurons. It will happen in the adrenal medulla, and therefore they are called the adrenal glands because adrenaline is released from there. Now further action, now once noradrenaline is formed, it will be stimulated and it will be released in the synaptic cleft. Once in the synaptic cleft, then it will show its characteristic actions by acting on the postsynaptic as well as presynaptic receptors. The metabolism of noradrenaline, mainly noradrenaline metabolism is inhibited or terminated by reuptake. Reuptake is in the vesicles is the principal mechanism through which action of noradrenaline is terminated. Vesicle reuptake. This step is inhibited by cocaine and tricyclic antidepressants, TCA. This reuptake step. So if reuptake is inhibited, it will lead to prolonged action or excess action of noradrenaline. Mainly action is terminated by reuptake and partly by metabolism through a monoamine oxidase and a catechol O-methyl transferase, which is COMT. So this is the synthesis: tyrosine to dopa dihydroxyphenylalanine, then to dopamine to noradrenaline, and noradrenaline to adrenaline in the adrenal medulla. Now moving further. Types of adrenergic receptor. Two types, alpha and beta. Both of them are G protein coupled. Now, how to remember these locations? It can be confusing at first, but it is very easy to remember, like we learned. Sympathetic system, fight or flight. Okay, flight or fight. So, always remember the receptors in this way, like write alpha 1 and beta 1 in one section, make a box around them, right. Write both of them together, alpha 1 and beta 1, and then alpha 2 and beta 2. Now alpha 1 and beta 1, both of them stimulate. Alpha 1, beta 1, both will stimulate. While alpha 2 and beta 2, both will inhibit. Remember this. Alpha 1, beta 1 stimulate, alpha 2 and beta 2 inhibit. Now there is a beta 3 here, beta 3 also, but I'll explain it afterwards. I'll explain it separately. It is not that important because it is only present mostly in the adipose tissue. So forget beta 3 for now. Focus on these four principal receptors. Start with beta 1. Beta 1 here, what is its location? Look in the diagram. Present in the heart and the juxtaglomerular cells present in the kidney. What will it do? Beta 1, we know it stimulates, so present in the heart, if it stimulates, it will increase heart rate. Obviously, in a life threatening situation, our heart rate will be increased. This is the action of beta 1. Heart rate will be increased. There will be increased conduction and increased force of contraction of the heart, because obviously the heart has to pump more blood. So increased force of contraction. Beta 1 stimulate, and through the juxtaglomerular cells, what they do? JG cells release renin. So the renin, aldosterone and angiotensin system, it is another complex system. For now, just remember, renin release will lead to angiotensin formation, and angiotensin is responsible for increasing our blood pressure. Just remember this. So stimulation of the JG cells will result in increased blood pressure. So beta 1 stimulation, beta 1 present in the heart and JG cells stimulation will cause all of these actions. Alpha 1, beta 1, remember these together, then alpha 2 and beta 2. Alpha 1, beta 1 stimulate, alpha 2 and beta 2 will inhibit. So now how to remember alpha 1's location? Alpha 1 in every other smooth muscle, blood vessel or organ that is relevant to the sympathetic system, you will find alpha 1 there. For example, here it is present in the prostatic urethra and present in the eye, and it is present in the blood vessels here. So what will it do in the blood vessels? Obviously it will constrict those blood vessels. It will cause vasoconstriction. Why does this happen? For example, how to remember this? Blood vessels in the skin. Now in an emergency response, we don't need blood in our skin. We need it in the deeper organs. We need it in our muscles, skeletal muscles, to run or fight. So alpha 1 receptors present in the skin will cause vasoconstriction, decrease blood supply in the skin. Skin का blood supply कम होगा. That blood will be redirected towards our internal organs, like the important ones, skeletal muscles or the coronary artery in the heart, because it needs to pump more blood. So blood will be redirected there, and therefore in the skin alpha 1 will cause vasoconstriction. Alpha 1 will stimulate, so blood vessels present in the skin will get stimulated, will lead to vasoconstriction. Though that blood will be redirected to our skeletal muscles and other important organs. Now moving on to alpha 2 and beta 2 receptors. Alpha 2 beta 2 both will inhibit, means decrease, वो function कम करेंगे. Whichever organ or gland they are present on, they will decrease its action. Remember, alpha 2 beta 2 inhibit. Alpha 2, a presynaptic receptor. Here it is written as it acts as a brake, the sympathetic system, which means that whenever alpha 2 is stimulated, it will lead to what? Inhibition, which means decreased noradrenaline release or decreased sympathetic activity. Whenever alpha 2 is stimulated, the presynaptic one, decreased sympathetic flow. It is also present postsynaptically. We will see its functions. This is alpha 2. Mainly remember alpha 2 को main function याद रखना. It is a presynaptic receptor. It is also postsynaptic, but its major action, whenever alpha 2 is activated, it will decrease our sympathetic flow, which means sympathetic system की activity कम हो जाएगी whenever alpha 2 is stimulated presynaptically. Always remember presynaptically. Now coming on to the beta 2 receptors. Obviously beta 2 the same as alpha 1, I'll write beta 2 here. See, beta 2. Beta 2 will be present in all rest of the smooth muscles. Always remember, like we learned in the cholinergic system also, the sympathetic and the parasympathetic system both have opposing functions. So beta 2 present in the bronchus. So there, if you remember the parasympathetic system, अगर parasympathetic के functions याद हो गए तो sympathetic के functions याद करने की ज़रूरत नहीं है. More or less they are the opposite of it. Direct opposite action रहेगा. So in the bronchus वहाँ कौन सा receptor था? M3 था. M3 क्या करता था? ब्रोंकोकंस्ट्रिक्शन करता था. तो बीटा 2 क्या करेगा? ब्रोंको डायलेशन. ऐसा ही याद रखना. ऑलवेज द ऑपोजिट एक्शन. इफ यू रिमेंबर द पैरासिम्पथेटिक एक्शंस, यू कैन मोर और लेस गेस what will be the sympathetic actions. And then whatever the rest of the glands are present or smooth muscles are present, like bronchus, in the GIT, in the bladder, uterus, liver, skeletal muscles, and the blood vessels. Now there is one problem. Alpha 1 and beta 2 both are present. Alpha 1 and beta 2 both are present in the blood vessels. So how can we remember in which blood vessel vasoconstriction is happening and in which blood vessel vasodilation will happen? So for that we'll have to move on to the functions of the adrenergic receptors. See, I'll first explain the functions and then I'll come back to the selective agonists or antagonists at the last. Functions. See, in the GIT, obviously we know beta 2 receptor is there. You remember the location of alpha 1 and beta 1, and whichever organs are remaining, like glands, beta 2 will be present there. Now of course there are some locations where alpha 1 and beta 2 both will be present, like in blood vessels. But if you remember the locations of alpha 1 and beta 1, you can remember the beta 2 locations. So in the GIT, beta 2 present in the GIT. Obviously we have learnt alpha 2 and beta 2 both will inhibit. So inhibition means what? Relaxation. Smooth muscles of the GIT are relaxed by direct action of beta 2 receptors and indirect action of alpha 2. एग्जैक्ट ऑपोजिट एक्शन है पैरासिम्पैथेटिक का. वहाँ पर M1 रिसेप्टर प्रेजेंट थे, M1 एंड M3 इन द GIT. M1 और M3 क्या कर रहे थे? दे वर causing HCl secretion, constricting the GIT muscles, which led to peristalsis. M1 और M3. यहाँ पर beta 2 and alpha 2 both they will relax the GIT muscles. Now in the heart, we know the location. Beta 1 receptor is present in the heart. Beta 1. So beta 1, obviously we know alpha 1 and beta 1 both stimulate. Both of them, what they do, they stimulate whichever organ they are present in. जो भी organ में रहेंगे उसको stimulate करेंगे, उसकी activity increase करेंगे. Beta 1 in the heart, positive, increased chronotropic action, ionotropic action, and dromotropic actions, which means increased heart rate. Chrono means increased heart rate, iono means increased force of contraction of the heart, and dromo means increased conduction. Now in the blood vessels. Now there is a dilemma here. There are both alpha 1 and beta 2 receptors present in the blood vessels. What does alpha 1 do? Causes vasoconstriction. What does beta 2 do? Causes vasodilation or dilation of blood vessels. So, effect of the sympathetic system will now depend on the predominant type of receptor present there. इसका मतलब ये है जो भी लोकेशन में अल्फा 1 या बीटा 2 ज़्यादा रहेंगे उस पर डिपेंड करेगा कि व्हाट विल बी द एक्शन ऑफ द सिंपैथेटिक सिस्टम देयर. फॉर एग्जांपल अल्फा 1 स्किन में स्प्लैंचिक सर्कुलेशन. स्प्लैंचिक मीन्स नथिंग बट द एब्डोमिनल ट्रैक्ट, द जीआईटी ट्रैक्ट. जितने भी ऑर्गन है उनको स्प्लैंचिक सर्कुलेशन बोलता है. तो अल्फा 1 ये लोकेशन आपको याद रखनी पड़ेगी. वेरी इजी टू रिमेंबर बिकॉज वी नो अल्फा 1 कॉजेज वेसो कंस्ट्रिक्शन, मतलब ब्लड कम करना है वहाँ पे. तो ब्लड कब कम करेंगे और क्यों कम करेंगे हम? कोई डेंजरस सिचुएशन है तो वही ऑर्गन से कम करेंगे जिसको उसकी ज़रूरत नहीं है वो टाइम पे. द ऑर्गन विच डज नॉट रिक्वायर ब्लड दैट टाइम, अल्फा 1 विल कॉज वेसो कंस्ट्रिक्शन देयर. तो कौन से ऑर्गन्स को ब्लड नहीं चाहिए उस टाइम पे? स्किन को, जीआईटी को, ये सब मसल्स को ब्लड नहीं चाहिए वो टाइम पे. तो यहाँ पे अल्फा 1 का प्रीडोमिनेंस रहेगा. अल्फा 1 विल बी ग्रेटर इन नंबर in these blood vessels. In all other blood vessels which require increased blood during a time of emergency, we have beta 2. Beta 2 कहाँ रहेगा? Skeletal muscles में. Obviously we have to run, we have to fight. Muscles में blood increase होना चाहिए. And the coronaries, the coronary arteries. Coronary arteries heart को blood supply करते हैं. Increased blood flow to the heart obviously will lead to increased stimulation of the heart, increased action of the heart. ज़्यादा blood pump होगा. Moving further, in the eye, sympathetic action in the eye. Now we know alpha 1 is present in the eye. Alpha 1 as well as beta 2. Both are present. So alpha 1 what did it do? Stimulate. We know alpha 1, beta 1 both stimulated. Beta 2 inhibited or it caused vasodilation. So alpha 1 receptor will cause mydriasis because stimulation of alpha 1 will cause dilation of the pupillary muscles, increased diameter of the eye. डायमीटर इंक्रीज होगा तो लाइट ज़्यादा आएगी, लाइट ज़्यादा आएगी तो योर विजन विल बी इंक्रीज्ड. सिंपल. एंड बीटा 2 स्टिमुलेशन इन द आई विल कॉज वेसोडाइलेशन, सीलियरी वेसोडाइलेशन, जिसकी वजह से एक्वियस ह्यूमर प्रोडक्शन विल बी इंक्रीज्ड. नाउ दिस इज डेट्रीमेंटल इन ग्लोकोमा. ये चीज़ हमें नहीं चाहिए. बीटा 2 का एक्शन इज डैमेजिंग इन ग्लोकोमा एंड देयरफॉर वी यूज बीटा ब्लॉकर्स एंड अल्फा agonist in glaucoma treatment. Just remember the action of the alpha 1 and beta 2 receptors here. Now in the genital system, in the uterus, obviously beta 2 receptor is present. So uterus is relaxed. Inhibition of action, which means the uterus will be relaxed. While there is also alpha 1 present here. Alpha 1 receptors, activation of these receptors will facilitate ejaculation here in the genital system, because alpha 1 is stimulatory. All of the actions of the sympathetic system are opposite to that of the parasympathetic. So if you remember any action, like in either of the systems, if you remember the actions of one system, one division, you can just think like the opposite of that, and that will be the action of the next system. Now in the urinary bladder, obviously there was increased urination, so here there will be decreased urination. By beta 2 and alpha 1. Same is the case in the bronchus. There was bronchoconstriction. Here there will be bronchodilation. And in the bronchus, there is no direct sympathetic supply, but beta 2 receptors are present. So if we use beta 2 receptor agonists, they are useful in asthma. Beta 2 agonists, because we need bronchodilation in asthma. Now further, the metabolic effects. For metabolic effects, you just remember, we know beta 3 receptor location is in the adipose tissue. So beta 3 in the adipose tissue will cause breakdown of triglycerides to free fatty acids. Just remember its action in the adipose tissue. Triglyceride breakdown into free fatty acid by beta 3 receptors. Now for the other metabolic effects. Now obviously hypoglycemia is also an emergency. It is also a life or death situation sometimes. Hypoglycemia. So to counter this, our sympathetic system will be activated. To counter hypoglycemia, what we need to do? We need to break down glycogen. So glycogenolysis. Obviously we need glucose. We will break down glycogen. We will make new glucose, gluconeogenesis. Gluconeogenesis we will do. All of these steps we are doing to increase blood glucose. Hypoglycemia. So to counter hypoglycemia, beta 2 receptor present in the liver will cause all of these actions. It will cause glycogenolysis, it will cause gluconeogenesis, and also it will release glucagon. You all know glucagon is responsible for tackling hypoglycemic situations. Now alpha 2 receptor is also present here. Alpha 2 will also contribute to hyperglycemia by reducing the release of insulin. Beta 2, gluconeogenesis, glycogenolysis, glucagon secretion. Alpha 2 inhibits. What will it inhibit? It will inhibit insulin secretion. All of this is done to combat the hypoglycemic condition. ब्लड शुगर लेवल कम हो गया है, उसको कॉम्बैट करना है. वी हैव टू इंक्रीज ब्लड ग्लूकोज लेवल. सो इंसुलिन का एक्शन ऑब्वियसली इनिबिट करना पड़ेगा. दिस दैट इज डन बाय अल्फा 2 एंड ऑल द अदर एक्शंस विल बी डन बाय बीटा 2 to bring the blood glucose back to normal. Now for the other effects, like we know beta 1 receptor, the JG cells, juxtaglomerular cells of the kidney, responsible for renin release, responsible for increased blood pressure. And beta 2 stimulation can cause tremors. Tremors are also caused to signal a hypoglycemic emergency, or whenever there is a flight or fight response, beta 2 will be activated and it will cause tremors. So these are all of the actions. So this was the sympathetic system. If you have any questions, please write them in the chat, or we can conclude today's session. Any questions, please write them in the chat. This PPT will be provided to you in the group. Just go through it again. Okay. I'll conclude today's session. Thank you for joining everyone.